Hello, my name is Lance Swaney. I'm the clinical supervisor of the Trails program at White Cottage. What we ask them to do in family therapy is to be aware of their feelings, to check in around their feelings during the session. So that's great. That's great practice for them, sort of, real life, in the moment practice for them. And then they have to sort of identify the feeling, maybe what level they're at. And then if it is too much for them, then we ask them to suggest some kind of a coping skill so that it doesn't become unsafe or that it doesn't become unproductive. Oftentimes behaviors at home are very different than behaviors in the residential treatment facility. And so we had a major disconnect between the two. So given the information from the family therapist about what life was like at home, we thought the only way that we could try to connect those two differences was to ask the family to come up and then actually watch the kid interact with their parents at Glade Run, or in the unit, and that was very eye-opening. We use the sanctuary model at Glade Run, and a big part of that is emotional intelligence. So what that means is we want each kid to become more aware of their feelings and things that would trigger certain feelings, and then ultimately how they manage those feelings in ways that are safe. Safety is always one of our most important components, so that an individual's going home for a weekend visit, and that's sort of the time to practice. That's what I consider the boot camp. That's them getting some real seat time in the environment that they're accustomed to, and really where they've had the most trouble in the past, where they've been unsafe, because that's typically why they come to a place like Glade Run for help. So we have to be very careful around safety when they're going on their home visits. We do a safety plan for each kid. We include the parents in on that. Parents sometimes will develop a safety plan for themselves, because again, these visits can become stressful. It's not uncommon for family therapy to be tense or stressful for the parents, for their child. That's just a common experience, because everything that they've lived through, all of their history, all of their experience, it's the most vulnerable time for them, because it's their parents that actually are there participating with them. They can't hide anything. They can't avoid much. So saying that, it ends up to be the most productive time, typically.